Welcome to the Wellness Weekend. My name is Dr. Philip Ross, and I'm one of the chiropractors over at the World of Wellness. And spoke yesterday, kind of pertaining to basically just describing the anatomy of the low back and basically what we do in the treatment room, what you could do for yourself at home. And today we're going to be talking about the different modalities offered at the World of Wellness. So if you guys been tuning in over the past couple months, past couple years, you definitely know about the supplements, right? Our supplement store is great. We got a couple different products, a ton of nutritional frontiers, and you also know that we have chiropractors here. I'm one of the chiropractors, myself, along with Dr. Gideon Orbach. And today we kind of just wanted to give more information. Everybody knows about the supplements. Everybody knows that we have a couple providers here. But if you are, already on your supplement regimen, right, you feel comfortable with that, that's not changing. And if you're scared of seeing a chiropractor or just don't want to see a chiropractor, just wanted to kind of bring to the attention everything else that we have to offer here in this building. So I'm going to talk a little bit about the modalities that we offer, wellness modalities. So, we're going to kind of dive into what our infrared sauna does for your body. We also have something called a vibration plate, a whole body vibration. Some people like to call it the shake machine. We're going to talk about the Normatec compression boots and what that kind of does for your body. And then lastly, we're going to kind of dive into what we have and what I like to use in my treatment room is called a class 4 therapeutic laser. So we will kind of just dive into it. And I think first we'll kind of start talking about the laser therapy, just because that's going to be most of the chunk of time. And that's, I think, something that really separates our facility from other facilities. And just a quick preface about the laser treatments. So there are a couple other chiropractic clinics and other wellness clinics in the area that have a laser therapy, have lasers, but they're usually a class 3B, so it's a cold laser. What sets ours, what makes ours different from most of the other different kind of laser therapies in the greater Pittsburgh area is we have a class 4 therapeutic laser. It's actually a hot laser, and so the main difference is when you go for the cold laser treatment, the most you could actually kind of max out on is a 30, it's called 30 watts, and it's a pulsed treatment. So if you're treating a patient for 5 minutes, it's treating for 1 second, turning off for a second, 1 second, turning off for a second. And the class 4 therapeutic laser that we have, it is actually a hot laser. It's a 60-watt laser. So it's literally double the power, which is going to be a lot more beneficial for the patient because that means you're going to have to come in here less for the treatment, right? And also it's a continuous laser. So if we laser a patient, depends on what they're coming in for, pathology or the injury at hand, different durations of time. But the coolest thing about ours is, and when I first came over here, I approached Jamie and I was like, hey Jamie, I'm going to need a laser. And he said, all right, cool, send it over. He saw the price tag and he probably had a hard swallow, but he ended up getting it anyway, just because it's literally changing people's lives. I use it on a ton of different conditions. For most of the athletes, any kind of sprain, strain works very, very well with tendonitis. Use it a lot actually with diabetic neuropathy patients. It kind of works hand in hand though, right? So if your A1C is out of control, we're going to have to get your A1C down. And physiologically, you're going to have to be, around like a 5'7" or a 5'8", and then we could kind of start to laser your feet and basically just kind of wake up the nerves. And I'll explain what the laser therapy does for the nerves as well. So just kind of diving in, the history of the laser. Actually, it kind of started with Einstein in 1906, and he was basically just doing some experiments to see how light interacts with human tissue. And so how the laser works, and I'm sorry for everybody who heard this before, it's my laser spiel. I'll keep it less than a minute. Just how sunlight hits a plant for the plant to grow or heal, we're basically donating photon energy to the cells in your body so you could heal roughly 100 times quicker than what you normally would. And it works on a couple of different bases. So the laser emits something called photon energy, and the photon energy emitted from the diode hits your cell, and it goes into, if we go back to 8th grade biology or mitochondria, it basically hits that structure, and then it works on something called a chromophore. It basically is just a photosensitive receptor within the cell, and then you have three main things happen. So the biggest thing that happens is you're going to have an increase of ATP. What is ATP? Adenosine triphosphate. It's your cellular energy. So you're just going to be able to repair and turn over cells at a faster rate. And then it also allows for an increase of nitric oxide and O2 perfusion across the cell membrane. What's good about that is you're actually going to have more blood flow to the area, so you could heal a little bit quicker, and it's going to help with oxygen utilization at the cellular basically at the cellular. Oh, yeah, 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 and I guess we could talk about that briefly a little bit too. So, it makes my job a whole lot easier. So when I was using the Class 4 laser, again, I just had, one of my college wrestlers in, he had, separated his shoulder, boxer with any it's something called, chondromalacia patella, basically cartilage deterioration under his kneecap. So we use it on, basically athletes respond really, really well because it's literally gonna allow you to heal 100 times quicker than what you normally would. Dr. Len just made a comment. He was up here, I want to say that was probably a year and a half ago, or maybe 2 years ago. Long story short, he had an old disc injury in his neck. But then he also indirectly developed a little bit of lateral epicondylitis, also known as tennis elbow. Funny about that is Len is a golfer like myself. Golfer's elbow is medial epicondylitis. You feel it on the inside. Kind of weird though. A lot of people present with actually the pain on the outside of their elbow. I think that is due to probably the biomechanics of a swing. But anyway, long story short, we used the Class 4 therapeutic laser over Dr. Lenz. It's called a lateral epicondyle. It's basically the bone where all these extensor muscles originate from. So tennis elbow, in a sense, is an overuse injury. So what I like to use the laser for is it's going to decrease inflammation at the cellular level, and the only byproduct from laser therapy is heat. So once we heat tissue up to around 100 degrees, it becomes a little bit more pliable or amendable. Same analogy if we were going to try and bend cold rubber as opposed to warm rubber, it just allows it to work a little bit more efficiently. So we basically did the laser therapy over that lateral epicondyle and then hit the extensor portion of his forearm. And what I did before we actually even got the laser on him was we used Nutritional Frontiers transdermal CBD. Why did we use that? We used it because it actually has a really nice molecular structure where if you put the CBD on your skin, it's actually going to go into your skin, and then we use the photon energy to kind of enhance it. A lot of patients ask, "Hey, CBD, you guys, it's sold across the street. It's Sunoco. It's down the street. Can I get it? Does it work?" I'm like, "Yeah, you could get it." No, it doesn't work. Why it doesn't work? We actually had ours basically made by a pharmacist that came up with a structure. The structure, so when you put the actual CBD on, it goes into the tissue. It just doesn't sit on your skin. That's that lipoderm technology. It's basically the same that if you go to an endocrinologist, if you're a woman around that time of your life and you get hormone replacement therapy, some endocrinologists will actually give you a cream that you rub on your skin to get your progesterone or your estrogen into your tissue. Same basically technology that we're using, but we're coupling it with CBD. And CBD in its nature is an anti-inflammatory and a neuroprotectant. So I'll basically put that on, and then we'll enhance it with the photon energy from the laser just to have a massive anti-inflammatory response. And then we went in with Dr. Len in a couple of the other modalities I use is there's something called IASTM. It stands for Instrument Assisted Soft Tissue Mobilization. Long story short, we're basically just trying to kind of break up if there's any kind of residual scar tissue, or just basically break up any trigger points in the muscle. So what's a trigger point? Like a knot. Think of your muscle. It should kind of be sliding like this. And when you have deterioration, faulty biomechanics, same repetitive motion, sometimes you stress that muscle more than it once, and then you get like a knot. And so like the myofibrils in your muscle kind of tangle up like this. So what we do after we heat it up is we get that soft tissue, that Grasson tool, if you will, and we kind of go over the tissue, and over time, it's going to allow the myofibrils in the muscle to be in a more linear fashion, and that kind of works out your knot. So Len definitely had some hypertonicity or tightness in the extensor portion of his forearm. So once we heated it up, did some of the scraping work, and then I also do something called pinning and stretching. And you could even try this at home. So to do the pin and stretch of the extensor muscles of your forearm, what you're going to do is you're going to start with your palm facing down. You're going to go two strong fingers, and you're going to find where you're sensitive or like the biggest knot in your forearm. You're going to push really hard, and then you're going to open up your hand like you're holding a cup of soup, pop off, and then reset. And so we did this and a couple other things for Len, and it was pretty cool. His grip strength, I can't remember the numbers off the top of my head. When before we even started treating him, checked it, it was in the 70s. We'll just say 71. And then after we were done treating him, we reassessed his grip strength, and he literally went up like 30 pounds. He went from, I don't know if it was 71 or 74 to 101 or 104, but nonetheless, 30 pounds of grip strength that he gained in just like literally 20 minutes. That's pretty impressive. And if I'm not mistaken, when I talked to him down in Tampa earlier this year, he said it's feeling good. Now he wants to work on the other one. So, Len, next time you're up here, we'll definitely get you on the schedule and we'll get that worked out for you. So sorry, I kind of rolled off the laser treatment there, but yeah, long story short, it's just going to increase your healing capacity. If you want to look up research pertaining to class 4 therapeutic laser and what it does for your body, there's a fancy word. If you're going to go to PubMed or Google Scholar, it is called photobiomodulation. So when I'm actually looking up research articles, and I'm going to talk about a couple today, that's the platform I like to use. And you just type in photobiomodulation and then insert your pain, insert knee, low back, mental clarity, and all the research will come up. The word photobiomodulation is just essentially a fancy word that stands for how light interacts with human tissue. um, and there are some pretty cool results. And I guess I'd just like to say this point too. Not only do I just use it on the athletes, works really well with the tendonitis. We were talking about the diabetic neuropathy, but you have to have your lab work. Lab work should be pretty pristine for that to have its full effect. But also use it on a couple other pathologies that you don't think you would go see a chiropractor for. So we are not treating them for their disease. We're treating their symptoms. Currently, I'm working with 3 patients with Parkinson and 2 patients with MS. And basically, essentially, if you look at the literature about photobiomodulation and basically to help decrease the symptoms of Parkinson and MS, they're kind of the same, but they're definitely different. What the research has found is actually if you laser under their tongue and up their nostril, it's going to be the path of least resistance to your brain, and it's going to help with the most symptomatic relief. And then also with the Parkinson and MS patients, not only are we using the laser on them, but I'm going to talk about what another piece of equipment we have, another modality. It is called a PEMF mat, and I'll talk about what that does for them as well. And again, if you want to look up any research pertaining to that, if you're going to research the laser, it's photobiomodulation. And then if you want to look up what the PEMF mat does, you just simply go to Google Scholar or PubMed and type in pulsed electromagnetic fields, and then you can see all the research. But just a couple other points about the laser. So we talked about how it increases ATP, nitric oxide, and then it also helps with the calcium channel on a nerve. So I do use it a lot with people with the dreaded sciatic symptom, and I'll explain why. So you have 3 channels on a nerve. You have a potassium, a calcium, and a sodium ion channel on a nerve. When people are having any kind of like low back pain or neck pain and they feel it like running to an extremity, like, hey, my neck was hurting and now my hands going numb when I'm sitting for too long, or, I got like numbness, tingling, burning, itching, any kind of neurological sensation. Think of a straw with a bunch of holes in it. It's leaking. So that nerve, they call it depolarizing. That nerve keeps tripping, and then you feel your symptoms. What the laser does is it basically helps to reset the calcium ion channel. So you could think of it as you're basically patching up the holes in the straw so you have a better signal, so the nerve does not keep firing, depolarizing. So anybody coming in that had any kind of low back pain running down their leg, we'll do a thorough assessment to see if it's truly coming from a disc, pinched nerve, a couple other things, and then we'll basically through the exam see, we could kind of infer, if you don't have an MRI, where the basically the injury is, and then we'll kind of hone the photon energy from the laser over that specific nerve root. It's going to decrease the inflammation and help reset that calcium ion channel. Also, at the cellular level, it helps to, I guess we'll talk about well, I guess we should have, sorry, Phil, I should have gave you the PowerPoint. There's a couple articles in here, but I'll just kind of explain what they're doing. It basically just talks about how it helps to oxygenate the system. And this study, this was done in 2018, and it basically talked about how if you laser at the cellular level, you're going to have an upregulation of cytochrome C oxidase and hemoglobin. So essentially, you're going to get more oxygen to the area so your body could do what it needs to do a little bit more efficient and quicker. And then lastly, just talking about a couple other thing it does is it can accelerate nerve regeneration. I like to couple that with our neuropathies or neuropathies. I feel like I pronounce that wrong every single time. That neuropathies, and that is high in B vitamins, specifically B12 and B6 for nerve regeneration. And then we couple with the laser as well. Also, we talked about how it's going to increase the tissue oxygenation. Definitely helps with any kind of neuropathy, just because it's going to basically reset the pain threshold on the cell, and it also aids in faster tissue repair. Um, and again, this works great for any kind of tendinopathies, whether it is an Achilles tendinopathy, tennis elbow, quadriceps tendonitis. Why it works so well is it's going to decrease the inflammation, and then we're going to basically take care of like the chemical stuff, so to speak, in the room. And then I'm a huge fan of basically like home care for patients. So I guess here's I guess a good clinical pro here. If you're going to be rehabbing any kind of like Achilles tendonitis, golfer's elbow, tennis elbow, quadriceps tendonitis, if you're going to a chiropractor or a physical therapist, please make sure you're doing eccentric loading. That's the gold standard to basically recover from any kind of tendinopathy. And what is an eccentric load? Very, very simple. Let's take the bench press exercise, right? So when you take it off the rack and you're lowering it down to your chest, that is the eccentric motion. And then when you go to finish your rep and push up, that is the concentric range of motion. There's a lot of research, and if you truly want to make a full recovery from any kind of tendinopathy, you have to stress the eccentric loading portion. So I just talked to a lot of patients, marathon runners and half marathon runners, about this. That's one of the most common injuries, is any kind of like Achilles injury. And I'll basically have them in the room. We'll do all the good stuff in the room, and then I send them home with basically just like calf raises, but you're going to stress the eccentric. So if you're having any kind of like Achilles pain and it's nagging, it's not getting better, gets better, gets worse, but you're still having it, what you're going to do, very, very simple at home, you're going to get on a stair and you're going to do a calf raise up. And whatever the affected Achilles is, say it's your left Achilles, you're going to pop your right leg off and you're going to slowly lower for 4 seconds on the affected Achilles. And then you're going to put right foot down to buddy system back up. And then you're going to pop off and slowly lower down. That's, yeah, just a clinical pearl. If you have any kind of like tendonitis going on, you have to eccentric load it, or you're not going to make 100% recovery there. So okay. Great question, and it depends. um, so lasers, right? You have literally class one, which is basically ranging from like a laser pointer up to a class four, which is, I like to call it the Rolls Royce. There's a couple different companies out there. You could definitely shop around. I guess I could even get the contact information and talk to them outside of this, but there's a couple different wavelengths as well, and the I guess the older I get, you kind of realize you get what you pay for. If you're going with like a class 3B, nothing wrong with it. If this is a provider asking the question, nothing wrong with it. It's just you're going to have the patient in a lot more frequent and get more visits to basically get to the basically like for the full recovery. And I guess I could just say it like this. So on our laser, maxed out, it treats at 60 watts. And for 5 minutes, that's going to donate something called joules of energy. And ours donates 18,000 joules in 5 minutes. If you get that class 3B cold laser, it's going to take you 10 minutes to basically get to the 18,000 joules. And essentially that's what you want. You want to donate the joules of energy to the body so your body can basically heal as quick as it can. So you get what you pay for. One of my favorite companies, like we have an Aspen Pinnacle laser, very, very nice. That's a big one. They do have smaller ones as well, that are a little bit less expensive, but in all honesty, just what I've been seeing it doing for patients for diabetic neuropathy, any kind of athlete with an acute injury, how quick they recovered, especially if I put them on the PMF mat as well. I think it's definitely worth it. I mean, I have an Instagram. It's at Dr. Phil Ross, and we had a guy coming in. His toe was in pretty bad shape. And to make a long story short, potentially he's going to get it amputated. We were using, I like something called micronic silver coupled with ozone. It's 50 parts per million. And so he was basically using that. He was taking some oral silver as well. And then we were basically using the class 4 therapeutic laser on his toe. And it was kind of like night and day. Oh, Phil's going to be able to pull up a picture maybe. Okay. Yeah. It might be, it was definitely a couple months ago. But yeah, long story short, and actually one of the first things it was used for was wound healing. And I went to grad school. Go up, Phil. That one right there. Yep. So this is how he came in when he presented, and that's what his toe looked like. And can you go through the images? Probably not. Yeah, to make a long story short, we lasered him for 8 treatments, and it basically like closed up the. Okay, okay. Yeah, but long story short, guy didn't lose his toe. That's what it looked like prior. And then again, coupled with some supplementation, pretty heavy supplementation, and then the class 4 therapeutic laser, it kind of helped, basically clear it up and he didn't have to get his toe amputated. Fun fact about the laser, like I am a skeptic and I wanted to be proven why it worked. So I went to grad school in Logan University. It was out in St. Louis. And when I was in outpatient clinic, there was a patient, he was a quadriplegic, and he had an opened ulcer on his foot. He went to every single doctor, every single ologist you could think of to basically try and save his foot and potentially his leg. He was getting absolutely no relief. And so one of his family members was like, why don't you try the chiropractor? He's like, that is the dumbest thing in the world. They're going to have nothing for me. But at the time, we actually had a laser. And so the guy came in and we lasered the open wound on his heel. It was 2 times a week for 15 weeks and it was 10 minutes each session. It literally closed up the wound on his heel and he didn't have to get his foot amputated. So at first I was like, this is just a warm light. This ain't doing nothing. But once you see that firsthand and you basically see how that affected that guy's life, I was sold. And we just been running with it since. So we're getting a ton of relief on patients with that. I guess my long-winded answer is they are affordable for sure. In my opinion, I would spend a little bit extra money and get a laser that treats at like a higher wattage, just because it's basically going to cut the treatment time down for your patients, and they're going to get quicker, a lot better. So and then we were talking about what you could also use it for as well, neurological conditions. So whether it's like post concussion, help with the symptoms of MS and Parkinson's, that's really really helping my patients. And then we were talking about, I couple it with something called pulse electromagnetic field therapy. um, I guess the best analogy for the PEMF mat is it's essentially recharging the batteries of your cell. And what's kind of cool about this is NASA was actually like one of the bigger, I don't know if it's a company, basically bigger organizations that started to use it. So when their astronauts were going up in space and their bone density was getting significantly depleted due to the lack of gravity, and they just weren't feeling 100% coming down, they started to look around and they actually ended up getting the PMF mats to put on the spacecrafts when they go up into space. And yeah, it's essentially going to recharge the battery of your cell. And then I have a couple articles on what it does for treatment of non-union displaced fractures. I had a guy, this was the end of last year, 2 really bad back to back, sprained his ankle pretty bad. And he actually ended up having an avulsion fracture. What's an avulsion fracture? Basically, some of the tendon pulled some of the bone off of its attachment site. They wanted him to go for surgery. And I said, hey man, it's an avulsion. If you kind of go in a boot for 8 to 12 weeks and we do some laser and some PEMF, we could do another x-ray or another MRI to kind of confirm that healed, so you don't have to go for surgery. Long story short, he came in 14 visits. So we lasered his ankle 14 times, put him on the PMF mat, and he actually didn't have to go get a stabilization surgery for his ankle. So I like to use that for, we were talking about the neurodegenerative disorders, so like the MS and Parkinson's, to help with their symptoms. And then it's actually really, really good for fracture healing as well. So, and there's only, I guess I should talk about the contraindications. So, I mean, basically anybody could benefit from this. There's only a couple contraindications for a couple of these treatments. Pertaining to the class 4 therapeutic laser, contraindications: you cannot laser over a spinal cord stimulator or a pacemaker. So if you do have some of those, or if you do have that in your body, we would just have to stay away from it. And then lastly, me personally as a provider, I don't laser pregnant women. I know some providers do, but anything that's going to draw blood away from the fetus, I just don't want to do that. So those are going to be like the three contraindications to laser therapy. Contraindications for the PEMF mat is going to be same thing if you have a spinal cord stimulator or a pacemaker, or if you are currently undergoing chemotherapy IV. Chemotherapy, basically getting it intravenously. So those are only contraindications for that as well. And let's hear it. Another good question. So, a lot of people ask, hey, does this laser help with my osteoarthritis? To be completely frank with you, it's not going to clear your osteoarthritis if you're having trouble like having a terminal flexion of your knee. However, what it's going to do is how it brings all the healing factors to the area of the site of injury, or the tissue you're lasering. It's basically going to prevent the progression of osteoarthritis. So if you I guess I don't know to the extent of your injury. I don't know if it's just arthritis. I don't know if you tore your meniscus, all that kind of stuff. But could it definitely help? Absolutely. We were talking about once you heat tissue up to a certain degree, stuff becomes a little bit more mendable or pliable, if you will. So if you can't fully flex your knee, it could be from a couple different things. It could be osseous, so inside the joint. Or it could be soft tissue. So sometimes if people have extremely tight quadricep tendons, that's going to prevent you from going through a full terminal range of motion of flexion of your knee. So in that case, I would say honestly, come in and get it checked out. And if you have any kind of imaging like MRI or X-ray, bring that in for sure. But will it basically like get rid of your arthritis? Absolutely not. But will it help basically prolong the progression of you developing more osteoarthritis? Absolutely. So those are cool ones as well. When people are like, "Hey, I haven't been able to do this for like 15 years. My back's feeling better, so I thought I'd bring up my knee. I don't know if you could do anything about it." It's super cool when you start to work on that. They're like, I had no idea that I wish I would have known about this 15 years ago. So yeah, that will definitely help decrease the pain. As to getting your full range of motion back, we would have to kind of do a couple other exams and kind of just do a further assessment to see if it could help with that. And then other treatments that we do in there too. People have probably heard of cupping therapy. That got really popular, in my opinion, when Michael Phelps went on his crazy tear and won all the gold medals. So cupping therapy been used for hundreds and thousands of years, or hundreds or thousands of years. What that does, some people use it for different properties. In my opinion, what I like to use it is, I put the cups on because it's going to pull something called your skin and then your fascia. What is fascia? Fascia is essentially like connective tissue. I like to use the analogy, fascia is basically pantyhose that wraps around a muscle. So if you've had like a nagging injury and you went and got a massage, you saw a chiropractor, went to PT, did all this stuff, muscle scraping, trigger point therapy, and you're still not, getting any relief. Those are all basically compression therapies. So why not do the inverse and decompress it? So a lot of people with like shoulder injuries, those are tough ones. They came in, same thing. They tried a couple different providers, felt a little bit better, but the basically the symptoms still nagging. What I'll do is I'll actually put the cups on to pull the skin and the fascia off, and then in my opinion, static cupping's all right. So if you just put them on and leave them, but you get a lot more bang for your buck if you actually have the patient go through certain ranges of motion with the cup on. So I'll put the cups on, and then I'll basically have them go through certain terminal ranges of motion, just because it's going to allow the skin and the fascia to get off of the muscle, let everything breathe underneath. And then I think, cupping with movement is very, very beneficial. And then if you have old scar tissue, I like to do something I call it transdermal cupping. So if someone has like a nasty scar from like an old surgery, I do the IASTM, that muscle scraping, but then I'll also put a little bit of any kind of like lotion over the area. I'll put the cup on, and then I'll kind of move the cup along the skin, and it's going to kind of help break up some of that scar tissue as well. So we do cupping therapy as well. We talked about what PEMF does for your body, and then I lived in these for 2 days after the half marathon. That was 3 weeks ago. Long story short, I did not train properly for the half marathon. And I'll talk about the two supplements that really helped me. And then I'll talk about the modality we have that I definitely took home Sunday and used a lot on Monday. um, the supplements that helped me prepare for the half marathon. So I should have ran 10 to 11 miles once or twice, 3 to 4 weeks before the event. Life happens. I get busy, and I guess I could say I'm lazy, and I only ran up to 5 miles before the run. So I had a oh crap moment. And so I was like, okay, we need to kind of biohack this and see how I'm going to get through this. What really, really helped me was, actually two products that we have. We have the CircuCore, the nitric oxide booster, and then couple that also with our DMG, our dimethylglycine, and I'll explain why. The DMG, really cool. It actually has 5 U.S. patents. The two coolest ones being for rheumatoid arthritis and melanoma. What it does is it's a methyl donor. It's a methylator. So it's basically going to help with oxygen affinity within your body systemically. Why I used that a ton was because since I didn't train like an idiot, I was like, my legs are going to get super, super heavy because I haven't taxed them and basically built them up to what they're going to have to perform on Sunday. So I started with the DMG, and for endurance athletes and cancer patients, it's actually the same dosage. It's anywhere from 1,500 to 2,500 milligrams daily. And so a week leading up, I started taking a ton of that, because if you think about it theoretically, an indirect cause of that, if you have more oxygen in your body systemically, right? And if you take something like our CircuCore, or a lot of the ultra marathon runners will drink beetroot juice 48, 72, 24 hours before, it's a vasodilator, and it helps nitric oxide. So what's that going to do for you? Long story short, nitric oxide is produced in the endothelium of your arteries. So think of it as the inner lining of like a hose, right? So in your arteries, and what that's going to allow you to do is vasodilate. So it's going to basically allow your blood vessels to get basically a little bit bigger. So it will lower your blood pressure, and then you could get more blood moving throughout your body more efficiently. Indirectly, with the DMG in the CircuCore or any kind of like beetroot powder, you're going to be able to get more oxygen and more blood to the tissue. And indirectly, you're going to produce less lactic acid. Thank goodness, because I would have been struggling if I wasn't taking those two towards the end of the run. And then after, when I got done, that's when everything started to set in. So like taking those two supplements, fun fact, if you're a runner, when you get the onset of your heavy legs, that's basically a production of lactic acid sits in your legs get heavy. If you take those two supplements, that's basically going to I guess prolong the onset of your heavy legs, the lactic acid production. And then what I did after, me and my little brother, we went to my house, did an ice bath, and then we took home the Normatec compression boots. So Normatec compression boots actually were studied by the FDA. They're approved for treatment of stage 1 varicose veins. And basically, what it does is it flushes lactic acid and metabolic waste out of your legs. So lactic acid, we covered that. What is metabolic waste? Well, every time you move, your cells create waste, and we basically need to kind of flush it out, right? So the Normatec compression boots work on something called pneumatic compression. What is pneumatic compression? A very common question I get from patients is, "Hey, you got those boots; those are cool, but like, what about compression stockings? Will that work?" Those kind of help, but the difference between compression socks and pneumatic compression is analogy of toothpaste, right? So some people, when they get to the end of their toothpaste, just like, I'm almost done, I'm gonna throw it away. And then there's other people that are like, wait a second, I probably got like 3 more uses out of this, and they kind of like roll up, trying to get the max, everything out of the toothpaste container. That's what pneumatic compression is. So it's basically gonna squeeze from your distal extremity, so like the furthest down your foot, all the way basically up to your groins. And when it works like that, it works in levels. And so when all that blood flushes out, it goes to your vital organs and gets highly oxygenated and nutrient dense. So then when you start to get the blood back in your legs, it's basically just all the good healing factors, and then you just recover a lot quicker. So since I didn't train, not gonna lie, my joints were really feeling it, like my hip and my knee. Madeline, you from the run? Yeah. Yes. So did not train. So I was definitely in pain Sunday night, and on Monday was a tough day to treat in here. But no joke, like coupled with the supplements and then getting on those Normatec compression boots 5 times after, My legs felt great by Wednesday. My little brother, it took him a little longer because he's not fortunate enough to have the supplements and the boots. But I used those and I literally recovered like within 2 days. I felt pretty darn good by Wednesday, almost back to normal. So um, and the only contraindications to the Normatec compression boots, if you have an open wound, if you had a recent surgery, and if you have any kind of cardiovascular issues. So if you just have high blood pressure but it's managed and it's not like astronomically high, you could get on those. We'll kind of put you at a different setting. But if you have any kind of congestive heart failure or anything like that, usually don't put patients in there. Also, too, patients that hold edema down in their legs, we put patients on that too. So people are like, you know what, I have varicose veins, and it just seems like it just seems like the past couple years, like at the end of the day, like I just have a ton of inflammation around my ankles and my feet feel swollen. Went to my doctor. It's nothing going on cardiovascular wise. They said it was my basically my one way valves in my veins. So that's correct. So like you have one-way valves in your veins that are supposed to get blood back to your heart and out of the extremity, right? As you get older, they get a little bit weaker, and since we got gravity basically compressing down, where's your blood going to want to end up? At the distal extremity, at your feet and your ankles. So basically, patients that have been having problems like holding fluid, edema, swelling in their feet and their ankles, we usually put them on that because it's basically going to kind of flush everything out. If I'm talking to a patient at home, I would say like the most common reason for getting that is if you wake up in the morning, your ankles and feet look great. By the end of the day, your ankles are all inflamed and swollen. You would be a great patient for that. Basically, just is going to kind of you can't fix the one way valves, but it's going to be a good way to kind of flush everything out of your legs. All right. And then we could also talk too about we have something called a whole body vibration plate. That is some people call it the shake machine. I think that sounds pretty cool. Essentially what that does, if you actually look at the literature, that talks about how it's basically like good for your lymphatic drainage system. So if people don't have a whole body like a vibration mat, some people actually buy one of those like small trampolines and they do bouncing at home for lymphatic drainage. But I like to put people, especially the athletes, like before I treat them, I usually put them on the vibration plate for anywhere around like 5 to 10 minutes, and basically just have them stretch on it. The reason being, it vibrates very very fast, and so I like to call it. You actually get into the nooks and crannies of your terminal range of motion. So for the gentleman that asked about, hey, end range extension in my knee, I can't get there. You would most likely be one of the patients that, after we treated you a handful of times, in conjunction with the laser and some of the stuff we're going to do in the treatment room, we would take you out and put you on the whole body vibration therapy and have you basically kind of like working on your squat and just like different movements, just because it just allows you to kind of get in the, I don't know a better way to say it, the nooks and crannies of like the full range of motion of your joints. There was also studies, this was done in Norway, that talks about if you're on that whole body vibration plate, it actually aids in weight loss as well. But I would say the biggest take home for that is going to be the lymphatic drainage. And then great question. So, if you're a new patient, so like if I'm seeing you for the first time, you got to come in as a new patient so we could kind of do like a comprehensive exam just to see what's going to work best for you. I think right now our laser treatments are $50. And if you actually look in the greater Pittsburgh area, you guys could research for yourself. But most clinics, like it's at minimum 75 or $100, and not trying to never want to talk down on anybody, but a lot of them only laser you for like 2 to 3 minutes. And so when you come in here, just what the research shows about the laser therapy, around 6 visits is where you're going to get the most bang for your buck. That's when it's going to really kind of like reset your cells. So I usually like to tell patients, hey, realistically, this has been going on for you for like over 20 years, over 5 years, and you're just trying to like get relief now. Like, I wish I could treat everybody and them get off the table, do a backflip, and be like, I feel great. But let's face it, sometimes it takes a couple treatments. So yeah, I usually tell people like, look, you might feel a little bit better after 1 or 2 treatments, but right around that 6th treatment, you're really, really going to feel a lot better. So that's what I would recommend for the laser. But yeah, you would have to come in as a new patient at first, and then every other visit just for laser is going to be $50. Yeah. And then I guess last we'll talk about, so kind of cool. So we actually have three infrared saunas here. And I get asked a lot, what's the difference between a conventional sauna and an infrared sauna? So a conventional sauna, a good analogy for that is think of it as your oven. So it's basically going to heat the air around you, and then that's how your body's going to kind of heat up. What the infrared sauna is, think of it like your microwave. So it's actually going to heat your tissue up, as opposed to just kind of heating up the air around you, and that's where you get a lot more detoxification properties. Um, so, and also too about the temperature. So a lot of people sometimes they worry about, hey, that's going to be crazy hot, I don't know if I'm going to be able to sit in there for 20 minutes, 25 minutes. Cool thing about infrared sauna is it's not really as hot as a conventional sauna. So conventional sauna is usually anywhere from like 150 to 180 degrees, depends on where you go. And an infrared sauna is anywhere from like I would say like 120 degrees up to like 140, 150 degrees. So it's a little bit easier to withstand the temperature, and you definitely have a lot more detoxification properties as well. Last little comment about the infrared sauna. This was pretty cool. This study was done in 2020. This was in, oh shoot, it was either Finland or Denmark. They had a control group. So they basically studied a group of females that exercised 4 times a week at a moderate intensity. And then they compared them to a group of females that sat in an infrared sauna for 30 minutes 4 times a week. And what they actually saw was that it essentially mimicked cardiovascular activity, which I thought was really, really cool. So if you have a family member, friend, or loved one that can't exercise due to morbidly obese, double knee replacement, they just can't move well. Maybe they just don't have enough energy in the kick in the butt to go to the gym, or whatever the case is. If they can't exercise to kind of tax their cardiovascular system, that's a great modality. So that's what I would recommend for that. But I think I rambled enough here, but essentially, my goal today was to kind of get up and talk about, again, everybody knows about the supplements we have, about what myself and Dr. Orbach do in the treatment room. But it's, yeah, if you don't want to see a chiropractor, if you're scared, if you already have a chiropractor, but you come up here to pick up your supplements, definitely ask the girls at the front about some of our adjunctive therapies and our modalities, just because this truly is a wellness center. I mean, like I personally, I do lab work with patients. We also do LEGO scans, which is basically going to check different mineral and vitamin levels at the tissue level. I mean, we have a massive supplement store, and then we have two providers here. But it's honestly kind of like a one stop shop. So if you are like training for an event, right, like an Ironman, or you're going to run a half marathon and you're having the heavy legs, or if you had a heavy weekend, basically mulching your yard or anything like that, you could always call in and just say, hey, I would like to schedule an appointment for the Norman Tech compression boots, and the girls will help you out. You come in, they'll put you on. Depends on what you're coming in for, how long you're going to be, roughly 20 to 30 minutes. If you want to come in and just pop in the sauna, we have a TV in there. I have my Amazon Prime Video account, so don't buy anything. But yeah, like it's pretty cool. We have a lot of different modalities, and the reason why I love what I do is I truly feel like I was put on this earth to improve people's quality of life. And we literally have everything here to basically just make you as optimal and perform as optimal as you want, whether it's, on an athletic field, whether it's you just want to be comfortable getting on the ground to play with your grandkids, whether you have a lot of stuff to do at your property and, you just want to feel good. We're basically just trying to allow people to be as optimal as they can. So, thanks for listening to me ramble for 50 minutes. And yeah, if anybody has any other questions, call in for sure. I'll try and give you a call my lunch break, and we could talk about a little bit more in depth about the laser therapy. I could literally talk about that for probably over an hour. And anybody has any other questions about any other modalities we have, I'd be happy to answer and happy to help. So thanks for sticking in.